Good morning. Welcome to this video on the GALS screen. It is adapted from the GALS screen of Arthritis Research in UK. GALS screen involves the systematic inspection for joint swelling and deformities and the systematic assessment of joint movement. GALS stands for Gait, Arms, Leg and Spine. Before examining the patient, there are 3 screening questions which should be asked during the routine history taking. Firstly, do you have any pain or stiffness in your muscles, joint or back? Secondly, can you dress yourself completely without any difficulty? Thirdly, can you walk up and down stairs without any difficulty? A patient who has no pain or stiffness and no difficulty with dressing or with climbing stairs is unlikely to have any significant musculoskeletal disorder. Before we proceed with examining the patient, always wash your hands. Good morning, CK.
Morning.
Thank you for helping us make this video.
Welcome.
We'll start with inspection. Inspect the patient who is standing in an anatomical position. Observe the patient from the front, starting from the top and then looking down. We look for full elbow extension. Look for quadriceps bulk and symmetry, and then check for forefoot abnormalities. Next, observe the patient from the side. Look for cervical lordosis, thoracic kyphosis, lumbar lordosis, and knee flexion or hyperextension. Now, observe the patient from the back. Look at the shoulder muscle bulk and check for symmetry. Check for spinal alignment. Look at the level of the iliac crests, gluteal muscle symmetry, and then check for the popliteal swelling or any abnormalities. Then look down and check the calf muscles for bulk and symmetry. And finally, look for abnormalities and thickening of the Achilles tendons and problems of the hind foot. CK, please walk a few steps, turn, and walk back towards me. Observe the patient's gait for symmetry, smoothness, and the ability to turn quickly. Now please stretch your hands out. Okay, turn it over. Form a fist. Thank you, relax. Now I'm going to check your grip strength. Can you squeeze my fingers? Grip tightly. Thank you. Now, check your pinch for each finger. Very good. Now open your hands, turn it around again. I'm going to check for any tenderness of your knuckles. Very good. Put your hands together now and bring it down all the way. Thank you. Now bend your elbows. Good. Put your hands behind your head and push your shoulder back. Very good. Now stretch your arms out and lift them up all the way as far as you can go. That's very good. Thank you. Put your hands down. Now I'm going to pinch the muscles to check for soreness. Okay, now gently squeeze the mid-upper trapezius muscle to assess the supraspinatus tender point. And look at the patient's expression when you're doing that. Please open your mouth and then move the jaw from side to side. This is to assess the temporal mandibular joint movement. Very good. Next, please tilt your head to each side, bringing the ear towards the shoulder to assess lateral flexion of the neck. This is sensitive in the detection of early neck problems. Thank you. CK, now I'm going to assess the movement of your back. I'm going to put my fingers here. You bend down and touch your toes. Note that the thumb and the finger has moved far apart when CK bends down. Thank you. Now stand up. And it gets back together when he stands up. Now CK, I'm going to examine your legs. First, I'm going to bend your knee like this. Very good. I'm going to twist your hip like this. Good. leg down. Same thing with the other knee. Bend it all the way. And then twist your hip back. Very good. Now I'm going to check for patella tap. Slide your hand down the patient's thigh, compressing the suprapatellar pouch. This forces any effusion behind the patella. With the finger of the other hand, push the patella down gently. In a positive patella tap, the patella will bounce and tap. Good. Soles of your feet. Thank you. I'm going to squeeze your toes to see if there's any soreness. Very good. Thank you. And we are done. Thank you, CK, for helping us today.
Sure.
This concludes the GALS screen. But notice that the patient is perfectly positioned on the couch for you to proceed with a general medical examination, which is needed for all patients with rheumatic disease.